That to you then. Stop. Silent. Hi, good morning, everybody. So nice to see you folks again. This is a really wonderful to basically meet everybody again. This is a brand new year's. I wish everybody good health, happiness, and all the best for 2026. Now, we have been going through, all these webinar, and I really got a lot of good feedback for all the people who actually watched the webinar, engaged themselves to a better understanding more about diabetic, know about pre-diabetic, more about their potential health issues. And some people actually come back. And matter of fact, was very happy to see one of my customer kind of recognize me because I guess they see each other, but I don't really got to know them personally. But now they say, hey, I hear your lectures weekly. And one of the things is that, thank you very much for giving us all this knowledge and also getting Lo Shu Tea, because what happened to this particular customer is they lower his medication and diabetic medication, that is, and the wife actually has to do insulin. They still both drink the tea, and now the blood sugar improved so much, no insulin required. And another customer from United States was very happy to tell me about her experience because her diabetes. Now, when they are pre-diabetic, when they change diabetes, the doctors start writing, you are diabetic now, their insurance went up almost like double. So really, at the end of the day, I also talked to some of our people in Hong Kong, the insurance people also, they said, yeah, if you're diabetic, we'll increase your rate because you're going to have all kind of health issues coming along. So I guess it's so important if you are pre-diabetic, make sure you don't get yourself to rated become a diabetic. You just become pre-diabetic, and basically your insurance continue the same, not as go up. I think that's so important. Plus, most important is not only insurance, your health become better. So today, reason why I talk about why this is fatty liver will be so important. And majority people actually ignore about this fatty liver. If you're diabetic, 70% of the diabetic patient most likely get a fatty liver disease. So net result, if they don't take care of it, they don't change their life pattern to improve, wow, that will be a big issue because you're going to start getting cirrhosis of the liver, scar tissue of the liver, and your liver is not going to function well. Eventually, this liver will stop functioning. Oh, that would be terrible because at the end of the day, you got end up with potential death because of the liver not functioning. So anyway, today I think the lecture is very applicable to anybody who are pre-diabetic diabetes or they have some fatty liver disease. Make sure this is continue to maintain this area to be the same level not to get worse, because when you get worse, you have all kind of problems. Now, most of the people that according to the study, a lot of people don't understand that, and they just didn't think that, wow, is there really such a thing here? So it is true. So anyway, so we're gonna start a webinar now, and then we hope that you're gonna gain some really good insight about this. So I think this is going to be a very good lecture for everybody. Okay, today our webinar is basically is talk about, fatty liver, what is the warning sign, how can it go raise your diabetic risk, and it will be very, very simple to understand, and also really a lot of people just ignore this. And I think this is going to be a very good webinar for you to better understand what is fatty liver disease. Okay, so today we'll talk about how to recognize the early sign of early symptom of fatty liver disease, and then why fatty liver increase your diabetic risk, and what can you do to protect your health and your liver, because once you damage, it might not able to reverse back. Like, for example, you get cirrhosis liver, you can't get back except you get liver transplant and so forth. But really, at the end of the day, you got to protect that. And how can we should they help you? So we're going to talk about that. I think this is going to be a very good insight for you to understand. Now, I noticed a lot today, a lot of people I don't have not met in the people list here. I don't know who they are, but I'm sure they came from new areas. So I will always want to catch up. A lot of people, why, how you got diabetes? Usually go through 4 stages before you get to diabetic. The first stage is when your LDL cholesterol increase, damage the B cell coming from the pancreas. B cells will take sugar to the cells. When B cell damage, the sugar not going to the cells, then it's going more and more sugar circulate in the blood vessels. The problem is going to start. LDL cholesterol and the blood sugar add together, the blood become thick and going to start forming all the plaques in the vessel wall. Now, all these vessel wall, when you plaque form, you have less space. Second stage comes in. That's the time when your blood pressure start going up because less space of blood going through. If this going continue close up, then you have all kind of problems, meaning that you can have a stroke, heart attack, everything come from there. So diabetic is the key thing is they form plaques everywhere. The entire body is not only one place, entire body. That's why you need to start from not only just from the blood sugar going up, but when your blood pressure got it, you got to start working on it to change your lifestyle to improve. Now, if you don't do anything, the sad part is you will quickly move to the third stage, which is pre-diabetic stage. The pre-diabetic stage, every doctor measures the same thing to identify you are pre-diabetic is everybody will have hemoglobin, which is this red blood cells here. And we'll measure the percentage of sugar attached to this hemoglobin. If you are 5.7 and below, you're excuse me. Oh, sorry. Yeah, sorry about that. Oh boy. I'm a little bit allergy. So you are basically a normal person at 5.7 below. Sorry about that. If you are if you're 5.7 and above to 6.4, now you become a pre-diabetic. Now in pre-diabetic, the sad part is the doctor is now giving medication because there's no medication for you. You're not diabetic yet. You're just pre-diabetic. The doctor will tell you, hey, Mr. So-and-so, you are now a pre-diabetic. Now you have to really do something for yourself. You have to change lifestyle. You have to eat low-carb diet, low-fat diet. You have to do exercise. You have to do 10,000 steps a day. Make sure that you continue to do exercise. And then you also have to lower your weight. If you're BMI 30, you have to go down to BMI 23. And so all these guys say, wow, okay, I will do this. Now, majority would listen to this, and then most likely in a month or two, they pretty much forgot because you have no pain, no incentive to really change. One thing can help you is really drinking low sugar tea. Low sugar tea can actually help you to lower your blood sugar, cholesterol, and your blood pressure. So the three highs are being lower, then you become a much healthier person, and not necessarily you decrease your risk to go from your pre-diabetic to diabetic stage. Now, if you don't do anything, the sad part is in about 2 to 3 years, you will convert to a diabetic. A diabetic is when you have HbA1c, they go from 6.4 over to 6.5, 7, all the way to 7. When your A1C over 7, doctor will definitely give you medication to get you to lower your blood sugar. So net result, your journey will become a diabetic journey, and that will be terrible. If you don't control well, your sugar will just continue to go up because the body will get insulin resistant. Eventually, you'll become a very flu moment, a diabetic patient. You're going to end up with insulin and da da da. It's just go on. And it affect all your body, affect your heart, brain, and all kind of problems come along. Could prevent stroke, blindness. You have your nerve damage. Then you have, end up to cut off your foot, dialysis. All these serious issues will come along, will be terrible. Now, why we talk about low sugar tea? Why low sugar tea? Really, low sugar. There's only two things. It have guava leaves in there, which delay the absorption of sugar into the bloodstream, so less sugar there. And secondly, there's bitter melon. Now, bitter melon is a wonderful food. This is not a drug. This is just a health food to help you is make it in the tea form so you can drink easily. And what it does is increase the insulin sensitivity, and they will take the sugar back to the cell. Wow, that's wonderful. So when your sugar in the cell, you can use it and you get energy. But the wonderful thing about bitter melon, the excess sugar, and also all the cholesterol, the bad cholesterol, and the salt, they will dump it off in the urine instead of reabsorb to the body. Plus, they will detox. So net result, your three high will go down: your blood sugar, your LDL cholesterol, and your blood pressure will come down. Plus, it detox. So this is really a product that is really natural, not a drug, just a food you drink. Tea 6 to 8 cups a day. That will help you to do that. A lot of people just drink 6 cups pretty much in a 2 weeks time. They are start seeing result already. Now, as a company, we don't want to just get to drink tea because you gotta start changing lifestyle. And if you train your lifestyle, man, you can live longer. You'll be healthier. You'll be able to do all kinds of things. What do you mean change your lifestyle? First, you have to drink low sugar tea 6 to 8 cups a day. And you have to start really focus to use low carb diet, low fat diet. In other words, no longer you can go 3 ice cream a day. You can eat all kind of fats. Now you have to cut it down. So you got to do a lot of vegetable, a lot of instead of red meat, you do maybe some fish, more fish. A wonderful diet for you. Secondly, you have to exercise. You have to 8 to 10,000 steps a day. It's very simple. Just walk. You don't need to actually, do like a lot of exercise. Now, a lot of times that a lot of people say, hey, I'm in a area snowing. Oh, get up a step master. This step master, you just go, and then you got a barbell. Just go do this, with a barbell and go up and down like that. Okay, while you're doing a step master, half an hour, you burn 300 calories. And you can still watching TV at the same time doing that. And then with that, you control your weight. You lower your BMI to 23. Now, that's take works, really, at the end of the day, because it took me almost like 2 years to minus truly 200 pounds. I mean, sorry, 20 pounds of from 250, 225 pounds all the way to 200 pounds, and even got lower. But it took 2 years. It took works, really took works. Now, certainly I could do some fasting, but every time 1 month is just like 1 pound here and there, 1 pound, and it's slowly going down. But with that though, my A1C actually went down 1 point. So if you minus 10% of your weight, your A1C will improve 1 point. That would be wonderful. Now, we have weekly webinar, which is free for you, and you can see this QR code. You take a picture, and then you can scan here. You basically can capture all our lecture. We have 400 lectures in the YouTube, which you can select to listen at your spare time. And on top of that, you can able to do your blood tracking, and you can write down, each day what is your blood sugar, what you ate, how many steps you ate, and also your weight. Now, this we have a system for you to actually look at, and you can just a page to write down, and it's easy. So with that, now you can see, wow, I have a trend. I know what it is. I know what my sugar coming down. So important to really scan this to look at the lecture. If not, you can just write down here www.youtube.com/@ctteas@low/video. You will see the entire 400 videos in there as free for you to enjoy. Okay, let's get down to the true lecture now. Okay, what is fatty liver disease? Now, fatty liver disease, there are two types. Now, one is the less severe type. One is more severe. So the first one is your liver fats kind of build up to more than 5% because the metabolic issue, formerly is called non-alcohol fatty liver disease, which is NAFLD. But now it is called metabolic dysfunction associated with cirrhotic liver disease, which is short form as MASLD. So this is a new name. They refer this, and this condition, basically your liver start getting fatty and greater than 5% due to the metabolic issue. But on the other hand, you are not a heavy alcohol user, so this is the terminology they gave. Now, second one, which is more severe now. Matter of fact, many diabetic patients have that. It's called MASH. This is more advanced stage because your liver, because of all the fatty, it start getting inflamed. And then after inflamed, it's starting, scarring the liver. Now that is bad because when you have scar, you're gonna start a medical term as stenohepatitis, which is not a really good thing to have. Now, certainly this is an alcoholic also, but this the issue is the fat that start building up, and then the liver become inflamed. It start damage the liver cells. After damage liver cells, the liver becomes scar, which is called fibrosis. And then next step, they will get a cirrhosis of liver and potential even cancer liver. Now, net result of that, you got to screw up liver until the liver is really total dysfunction. So this is not done by alcohol, but most of the people tied with this is by obesity, diabetic, and high cholesterol. So you have three things. The chances you got MASH is high. So let's get some understanding how these three look like in a picture form. Now, first of all, you have normal liver is right here. You can see that. And you have the normal liver, but you have now some fatty liver issue, which is MASLD. The fat start building up. So the liver still looks okay. It's kind of shiny looking. But on the other hand, if you don't take care of this now, eventually it's going to start changing. The liver become inflamed. And so net result, you go into the next stage and the liver start getting scar tissue, which is called fibrotic. So fibrotic, the liver looks more irregular, and then you start doing scar tissue and liver start dysfunctioning, but not as bad yet. But as time goes on, you don't take care, you know how the liver look like? It becomes cirrhosis. The liver actually shrink, become bumpy, hardened, and then a lot of scar. And eventually the liver are so excess that doesn't work anymore. And eventually that if it become an irreversible cirrhosis, that liver will eventually stop function. And net result of that, people die with that. Okay. So you really don't want to get that stage. But a lot of these people, when they get on this liver fibrosis, are usually related to a lot of people who are obese, type 2 diabetic, they have tremendous metabolic issue, and then naturally they continue to get the liver be inflamed and move yourself going to this route, and that's not a good route to be. So net result, you got to make sure that you don't want to go into cirrhosis of the liver. Now, just give you some statistics. Affected about over half of the people with obesity and type 2 diabetic, they have the early stage of the disease, MASLD, which is 90%. Usually severe obesity people, they will have this problem. And then actually that affect 25% of 1/3 of global population. That's a huge number. So every 1 to 2 million deaths globally each year because of MASLD. Now, this is something, and they're not due to alcohol. They're normal person because they just allowed it become to continue to develop the liver disease. So net result, although this is not a severe, but at least there's still a lot of people have it. Now I'll give you the next slide even more scary. This is for people who are diabetic. MASD, which is mean that the liver start getting inflamed and start damaging the liver and start getting scar and eventually become cirrhosis of the liver. But MASD started off affected 80 to 100 million Americans. In other words, that's 1/3 of American population potential of this. So up to 1 to 4 will progress from the earliest stage now to MASH, MASH. So really sad because you could prevent this happen. If you prevent this happen, you never get into the stage. But 1 in 4 will progress MASH. And usually it's not no race difference. In other words, you could be Asian, blacks, white, doesn't matter. It will have that. And they even expect the MASH case will go to 63% because of people dieting and not really aware, didn't take care of it. Sorry, I'll drink some water first. Sorry about that. Low sugar tea is not water. And 11% may develop cirrhosis of the liver. And when you get cirrhosis of the liver, they can have end up with liver failure, and also sad part is potential also liver cancer. So it's become a really a serious issue. But on the other hand, you can actually prevent it. Now, who have this high risk? Now, if you have diabetic, you gotta really watch because the risk is definitely there. If you're overweight or obese, you also need to really watch because this is something that uh, a lot of people will have this overweight and obese are the key subject. Poor dieting, where you always go for high cholesterol, high sugar diet. These are, and I don't eat vegetable at all. And a lot of Americans, I only eat red meat. Really because of that, they also have that issue. High cholesterol also issue, high LDL, triglyceride, all these good stuff are in there. And also you have over 40 of age. Wow, man, that's a lot of people over 40 age. So even you're 40 years of age, you got to really watch, right? And also your high blood pressure. And then on top of that, you will have a very sedative lifestyle. I don't move, I don't ride bike, I don't exercise at all. All these are potentially the problem you have for getting yourself into liver disease. Fatty liver disease is a silent killer because most of the time, really, you have no actual symptom. You best don't know pain. If you have early fatty liver disease, you have absolutely no symptom usually. And eventually, because of continued same progress of same lifestyle, don't change, you exercise, you eat a lot of fatty foods, sugary stuff, little vegetable, and slowly progress more and more to over the years, then you go to MASH. And most people don't feel sick until the later stage. Where the MASH will really go down when you get down to really get a lot of scarring, inflammation, liver, that you feel the disease there. The early warning sign will be really usually feeling very tired, sluggish, no energy, and start feeling discomfort on the liver area, and heaviness and upper right belly area. A lot of these people usually already have a fairly big belly. And so a lot of these issues, they might ignore the sign or actually don't even understand that is the issue that's coming. And some people lost appetite, and even some people unexplained some kind of weight change. So these are the early warning sign that is happening. Now, however, the important thing here is if you have fatty liver, you actually increase your diabetic risk. That even a bigger problem because your diabetic risk can be future big issue for you beside your liver disease. The fatty liver disease actually contribute why you're diabetic because they increase insulin resistance. Now, when you get insulin resistant, guess what? Your body are not taking the sugar to the cells. Net result, your sugar will continue goes up in the bloodstream because it doesn't go to the cells. So your sugar keep going up, you become a true diabetic, right? So insulin resistant lead high blood sugar, and then the MASD will be linked to pre-diabetic and diabetes, type 2 diabetic, because the sugar keep going up. So you know what? Your A1C will go up from 5.7 to 6.4. You didn't take care. Eventually, your blood sugar kind of goes up. Your A1C will go up 6.4. Now you become diabetic. And that's how it works. So fatty liver disease actually increase your diabetic risk. And that is a very true things that you need to think about and really don't want to do that. And also, why also build continue raise the blood sugar? Because the fat build up your liver and damage the blood sugar levels, because the liver is actually also help you to monitor, make sure your blood sugar regulated to be a normal level. But this start breaking apart because of the fact that the fat build up the liver, a damaged liver no longer have the same function. So fatty liver disease, there are several risk factors coming into you also, because usually you're diabetic. For one of the issues is usually you always be overweight. Okay, majority, you're overweight and you're obese, and usually what all the symptoms you have is elevated blood pressure. Remember, the cholesterol and the sugar add together, the blood become thick and start making plaques everywhere, so your blood pressure goes up. And also your cholesterol usually also up. So all that is the key factor link you to type 2 diabetic. Now, you have high blood sugar all the time. Now you have A1C over 6.57 and up. It damages your organs, including your liver. It damages your organ, meaning they start plugging everywhere. So it can damage your heart, your brains, your nerve, everything. But liver also will be damaged because it contributes more fat build up, and it become a vicious cycle. Your liver start getting damaged. Eventually, you get more and more damage. You become a MASH case because 70% of the people of type 2 diabetic has MASH, M-A-S-L-D. Wow, that would be terrible. In other words, you're going to now end up, instead of normal antibiotic, but you affect your liver, you become really a bad case. Your liver becomes inflamed, scar, eventually becomes cirrhosis of the liver, and actually liver becomes shutting down. So you don't want it in that rate. So you need to learn how to control, not to get so worse. Now, complication, if you're not treated, the progression of MASH, first of all, you inflame your liver, it got inflamed. Secondly, it starts scarring. It's called fibrosis. And eventually, it gets worse. It goes cirrhosis of the liver. And that result, your liver becomes really bad, not functioning. So now you have potential even high risk like liver cancer. And with that, your blood sugar also out of control, continue to go up and up and up. You also eventually have more serious items like heart disease, could be stroke, could be all kinds of things that come along. Wow, you don't want to be in that rate, right? You want to be really, don't get all these crazy issues that come along. So how do you identify this fatty liver diagnosis? Well, the most important is blood tests, because the doctor will do a blood test and look at liver enzyme. And a lot of times they also say, hey, I need to look at livers, how bad it is or how it was look. So they will do a usual ultrasound, look at the liver, how it look like. Is it smooth, ugly looking, or rough like? And also in your checkup, they usually check this all that and look at your blood sugar and everything. So make sure that all that can conclude, are you really having a serious liver disease, or you can now start working to control that, not make it get worse. And that's the important thing. So check up with the doctor, with blood test, ultrasound part is the way to go. Now, it says, shit, what do I do today? You can prevent it. You know what? You can start getting healthy diet, regular active exercise, meaning I walk, 10,000 steps. I will do 100, 50 minutes per week. I will maintain my healthy weight. I'll get my BMI to 23 instead of 30. I will continue to manage my blood sugar and my lipid. So meaning that LDL cholesterol has to go down and has to be under 216 and lower. So all these things you can do. So you have to control your blood sugar and your blood cholesterol. So when you do that, you know what? If you work toward the weight, if you lose 5 to 10% of your weight, you can significantly decrease the liver fat and improve your blood sugar. As I said, 10% weight, you lower 1.81C. So you got to keep your eye on blood sugar all the time and regular checkup. Now you become a much better health because you don't continue to get worse. Okay, that is the key objective. Now in food and diet, you now going to eat a lot of vegetable. My plate is half vegetable, a lot of fruits, a lot of grain. I eat lean protein, not red meat. I have fish, lean pork, chicken, cut out the red meat as big steak. And I limit my sugar drink, meaning that I'm not going to have bubble teas anymore. And I'm going to have just low sugar tea all the time. No sugar, no caffeine. And I will less the fried food. You know what? Forget about a lot of French fry every time you eat. Now all these things are gone. With that, you will continue to become much healthier diet. On the physical activities, I will always do 150 minutes of exercise, okay, per week. I will walk 10,000 steps a day. You said, I cannot walk, man, outside snowing. No problem. Do a step master, get 2 barbell. Go up and down. Do this barbell. You can achieve the same thing. You do you do half 30 minutes, you can actually burn up 30 calories, 300 calories. And you actually, because of you doing this exercise, it's open your chest, your chest feel bigger. You feel more energetic. And on top of that, you get all the fresh air going back to your lung. You are so much better. On top of that, you are bringing a long-term always sitting down for hour and hour. You don't do that anymore. If you sit over half an hour, you get one or every hour. You just stand up, walk a little bit, go to restroom, go to wash your hand. That kind of stuff will help you instead of just keeping sitting few hours. So more important, you have to making this change continuously to get movement because you don't walk. You know what? You cannot walk after 70 years old. So really, at the end of the day, you have to keep walking, strengthening yourself, body, getting exercise. Really, this is so short. I mean, so easy. But really, if you don't do it, it will just sort of end up no, you don't move anymore, and people will start and sit in a chair, and eventually a wheelchair to walk around or whatever. So no matter what, you gotta keep doing that. Plus, you gotta try to lose your weight. Lose weight is so important. With losing weight, man, I can tell you, your weight can really help you to get better control of your blood sugar, cholesterol, and blood pressure. If you change 10%, I mentioned, 1% A1C going down, you'll dramatic lower also your blood cholesterol, blood liver fat, and everything. So that is really something you got to do. Now, starting with one item, which we sell in Hong Kong, is called Pro Liver Tea, which actually uses natural herb to support the liver cleansing, improve mood and detoxing function, help break down fat, improve digestion, reduce your stomach bloating, regulate blood sugar, lower bad cholesterol, promote your overall energy. The wonderful thing is really it improves your liver fatty liver. And with that, you also improve your overall mood. That's really important. It's all natural. And because of that, you get better sleep. A lot of people loves it. And that's one thing that a lot of people try this in Hong Kong. They said this is really good. So at the end of the day, why this is really important to drink low sugar? Because basically regulate your blood lipid, lower your blood sugar, maintain cardiovascular health. And it is not a drug. This is only a food. There's no sugar, no calorie, and promote totally healthy eating habit. And drinking those smoothies, basically, it's just 6 to 8 cups. It removes your LDL cholesterol because it had from urine, they dumped it out. Excess cholesterol, LDL cholesterol, it just dumped out urine, also dump out sugar at the same time. And it also help you detox. So net result, your blood sugar, cholesterol, and blood pressure continue good. So all you do is just daily do that, and then you pair your low sugar with diet, and that will be wonderful to continue to help you improve. Plus, you gotta get your exercise, and also pay attention to sugar intake. No more, really funny bubble teas anymore, because that would not really help you out. So continue. In conclusion, you really have to understand your personal risk for fatty liver. And the diabetic, the first step is protect your long-term health. It's so important. You have to say, hey, I'm 50 years old now. I gotta really help myself to become healthy, because from here on to 80 years old, that's 30, 50, 40 years, you got to form a lifestyle change, because you're during this time, you gotta restart thinking, hey, my diet has to change, meaning I have to eat a lot of vegetable, a lot of beans, a lot of fibers, oats, but really not to eat a lot of white rice. You cut off the white rice. I only eat the red rice or brown rice. And you have to eat a lot of fruits, okay? Meaning that I'll start eating a lot of pears, apple, that kind of stuff. And also, you need to start taking lean protein, like chicken, white meat chicken, a lot of fish. So it significantly reduce your liver fat formation and improve your blood sugar control and your cholesterol control. Regular activities to strengthen your muscles, exercise, and your body weight, meaning I will still walking, 10,000 steps a day. So my weight will continue to go down. If I can control my weight to go down at least 10%, I improve 1% of A1C. That would be wonderful. And with that, so now you improve your weight, lower your weight, that's mean your diet control, your exercise, and you continue to monitor all the time your blood sugar and so forth. So everything are in good shape. You got to work with your doctors to continue to routine check your liver screen with your doctor to ensure that you are understand where your liver is at this stage, and you can make sure continue to change your lifestyle to ensure it doesn't get worse, because you can only control the liver to make sure that it doesn't get down to liver cirrhosis liver or scarring the liver. And that's most important. So really just a small lifestyle change today, you can really give you a lasting improvement of your health and also well-being. And you can also reducing the likelihood getting really serious complication in the future. And I hope that in your 2026, you can start giving you a mission for yourself. How do I improve my better health? And that would be so wonderful. Just like some of my client in the saw me and want to take a picture together with me because they appreciate what they learned. They said, wow, because of your lecture, I start changing my lifestyle. And you know what? My medication goes down. I become healthier. The important thing is not just drinking Lushu tea. Important thing, we help them to understand what type of lifestyle they have to change, and they start doing it, meaning the weight start going down. Not only 10%, they get 20%. And they start getting the diet change. Used to be a lot of meat, red meat I'm talking about. Now they eat fish, a lot of vegetable, a lot of oats. No more white rice, no more white rice, or brown rice, or also a little brown rice, that is, or red rice, or fibery stuff. They help them, and they have all the good stuff that they're eating with vegetable and also fruits, which is like pears, apples, and berries. They said their fruit in the morning look so beautiful, colorful, because they have blackberry, blueberry, strawberry, and some pears. Add together. That's the breakfast. And no longer is a sweet donut. No more sweet donut. Okay. And there is some, there's really brown bread, wheat bread, all these good stuff that they intake. Now, that lifestyle change actually took almost, a lot of people said it's not 1 or 2 months. It take about maybe 6 to 8 months to change lifestyle. But I'm assure you, if you change lifestyle, you exercise, lower your weight, control your carb intake, and then drink low tea, I am very sure at the end of the day, you'll be very healthy. So good luck on 2026. And thank you very much. I'll continue to listen to our webinar. I appreciate your participation effort and have a happy and healthy 2026. Thank you very much and listen to our lecture. I hope that you can send us message to let us know. Need some questions, write down to Andy at wahfong.com or write to us in WhatsApp 852 country code 67928891. And net result, I have a lot of people write to me, and thanks for you watching this webinar. I appreciate you continue to participate and have a nice, really wonderful and healthy new year. And 2026 is going to be something that you got to change to make sure you are continuing